Today I'm gonna try to quickly, but probably not very quickly, go over what it takes to become a CNA and what it's like working as a CNA. So enjoy. Okay, to begin, we're gonna go over what it's like to become a CNA in training. We're talking student nursing assistant, nurse aide in training, SNA, and AIT. Each facility, each program calls it something different, to be honest. So you want to be a CNA. Are you prepared to put in the time commitment and the monetary commitment that it takes to become certified? Now, when we're talking training programs, you have to have the interest, of course, to get the ball rolling, because these programs can take anywhere from 10 days to a whole school year. It really depends on where you're going. I did a month-long course. I did about 35 hours of online training and 40 hours of clinical training. I got my training for free because I did it through the nursing home that I work for, but that is not always the case. You can go to a tech program through high school, you can do a tech program after high school, you can find random CNA training centers that kind of exist on their own outside of college and tech schools. Or you could go down the route that I went down. I went to the nursing home closest to me. They were hiring for nurse aides in training, and I said, hey, can you train me? And they said, yeah. And I said, do you guys have a contract required? And they said, no. So I was like, cool. Yeah, you have to be prepared to do at least a month of school. 35 hours online doesn't seem like a lot, but that was about 3 weeks of constantly going to school. I didn't do it every single day because I still had a full-time job. I was working as a PCA and as a line cook. So just take into consideration that it does take up a decent amount of time, and if you're not getting scholarships, it can be significantly pricey. It can be anywhere from a couple $100s to a couple $1,000s. It's just extremely program specific. You'd have to look up in your area and find some place you're interested in going and go from there. Do keep in mind that if you get free training for a facility, they might have you on a contract, 6 months, a year. I've even seen one before that was 3 years, where if you break the contract and leave the facility within that allotted amount of time, you will legally be required to pay back all of your fees. So keep that in mind. If you sign a contract with somebody, make sure that you really want to work there for an extended period of time, and that that's something that you really want, so that you're not out thousands of dollars. Now, when it comes to monetary things that you have to buy for training, I've seen lots of CNA students get very overeager, buying themselves custom bags, scrubs, stethoscopes, notebooks, like pulse oximeters, so many things. And to be quite honest with you, all you need for school are scrubs, a good pair of shoes, maybe a good notebook if you're a note taker, and a stethoscope is probably important. I needed that for my CNA schooling, but to be quite honest with you, I did not need them for clinicals, and I don't need them now that I'm working because the nurses all have them. And if I need to take a blood pressure, generally the nurses have the ones that just go on their wrist, the automatic ones, Don't spend all of your money on a nice fancy stethoscope, especially if you're going into a long-term care facility. You won't need it. Other expenses that you might have to partake in for going to a CNA class are a TB test, BLS, or CPR. Generally, CPR is okay, but some places will want you to have like full BLS for healthcare providers, a background check, and your vaccination record. So there's nothing on the wall because I'm recording this afterwards because I just remembered I also needed to buy a gait belt for my school, and I do need that to work. A gait belt is very important, to be quite honest. So a couple of the places that I've worked required me to pay for my own background check. Usually it's anywhere from $15 to $30. Just depends. My TB test was covered by most of my employers except for one in the past where I just, if you're not familiar with a TB test, it's a tuberculosis test. I don't know the scientific name off the top of my head, but I think it's something that starts with an M. Either way, they take one of your arms, it doesn't matter, one of your forearms. It is a intradermal test. It just goes into your skin. It's not supposed to go into your fat or your muscles. Sometimes they do go a little bit too far and it hurts, and I'm pretty sure that invalidates the test. But what they do is they take a needle, they kind of push it into your skin a little bit, inject a tuberculosis serum, kind of deactivated tuberculosis serum, and it's monitored over about 48 hours. You'll have a little tiny bump to begin with that kind of looks like a welt, a white welt, because it's generally not red right when you first get it, and it very quickly dissipates, and you might have a little pinprick where they put the needle and some bruising around it, but generally if your test is negative, you'll not get almost an allergic reaction type reaction. It should not get red, it should not get swollen, the welt should not become bigger. It should go away and really should only have a little bit of bruising. I get bruising. I don't know if that's normal for everybody else, but every time I've got it, I get a small bruise, but all of mine have been negative. It doesn't hurt, but I do have vasovagal syncope, so I do pass out like every time, and the nurses usually get a pretty good kick out of it because, I mean, it doesn't even hurt. You don't feel it, but just the fact that a needle's touching me, I pass out. Clinicals. So, clinicals are pretty easily, generally you don't have all the responsibilities of a full CNA, or at least I didn't, because you're still in training, you don't have your certification, you don't know what you're doing. It's like any other job. You go the first couple of days, you're kind of following somebody around, you watch, you do, you teach. My clinicals were only about a week. In the state of Oklahoma, I believe it's only required you do 40 hours of clinical time to become a CNA. It is mandatory. If you go to a place like a school, vocational center, college, your clinicals are most likely going to be unpaid. But if you are going to school through a facility, like I did, a long-term care facility, I basically just got put on the schedule as an orientee, and I got paid at a lower rate. My current pay rate is $14.50 an hour, I think, $15.50, something like that. A little bit low, but good for the area. I live in the South. As a orientee, I made $11 an hour for the first 40 hours until I went and took my CNA testing up in OKC and passed the first time. It's, I'm not going to get into the test right now. Doing clinicals is a really good taste of how your job's going to be. I know when you first get a job, it's kind of like sunshine and rainbows, and the first few months is you like it, but it can be a little bit difficult because you're learning how everything's going. Clinicals is a really good taste to learn those hands-on skills and to understand what working as a CNA is going to be like. Because to be honest, I learned how to do full bed changes, how to change people, how to clean people in CNA school, but it's not really something that you fully know how to do until you put it to use. Theoretically, you know how to do it, but do you know how to do it best? No. I've been working as an aide for probably 2 years and a CNA, a certified CNA, for 6 months, probably 7 months now. I hit my 6-month mark and got a bonus recently, but I probably still don't know how to do it best. To be honest with you, when I'm putting briefs on residents that need a Hoyer or something, they can't stand up for me to put their briefs on. It's still quite hard to get the brief centered and exactly where you need it to be on their back. It's like unnecessarily difficult to gauge where it needs to go. And I've heard some of my coworkers say the same thing. I was changing somebody with my coworker the other day and she said, that is the most perfect I've ever put a brief on somebody ever. And I was like, yeah, it's like, it's a nice feeling. It's like, yay, I've accomplished something, even if it's mundane. It's like, whoa, I accomplished a new skill. But yeah, just understand that doing your clinicals is going to be unpaid or it's going to be low pay, and it's mandatory, which is something you have to take into consideration if you have to provide for a family, if you have a full-time job that you need to pay your bills. Most of the time you won't get to choose where you go for your clinicals. You don't get to choose when your clinicals are. You'll get a couple time slots and you can sign up for them, or they'll just sign you up themselves. I got really lucky the way that I did it through my facility. I gave them a schedule that I could work and we went from there, but it does not always work that way, especially when you're going through a school. Yay! You finished school and you're either working full-time until you finished your test, or you've passed your test, congratulations, and now you need to find a job. Searching for a job is similar to searching anywhere else. Apply wherever you need to, but be aware that not every place is a good place to work. When you're job hunting, I recommend looking at the Better Business Bureau at your state's nursing home rating. I mean, it's different for every state, but I know in Oklahoma, I can look up the nursing home or the facility that I'm considering applying to and seeing what it's rated for quality of life for the residents and the employees. Looking at how many beds the facility has, especially in a long-term care facility, is very important. There's different types of facilities as well. There's assisted living facilities. I'm not sure about the state of Oklahoma, but I do know in the state of Arkansas, because I live very close to Arkansas, that assisted living facilities can hire people that are not certified nursing assistants. They can hire people with PCAs. Honestly, you don't even need a caretaking background to get hired at an assisted living. So research the legal aide to resident ratios or aide to patient ratios. It depends what kind of facility you're in. Long-term care, assisted living, they're called residents. Home health, they're called clients. In hospitals, doctor's offices, etc., they're patients. But I personally have the most experience with long-term care and home health, which is what I'm talking about. So research the legal aide to resident ratios, and when you go in for your job interview, ask them what their ratios generally are. 1 to 15 is the legal safe ratio in Oklahoma, and this includes aides and nurses. So direct care staff. It can be nurses, aides, RNAs, which are restorative nursing aides. They're certified nursing assistants with a higher certification or learning in restorative help, kind of like similar to physical therapy, but they're still a nursing assistant. You know what I'm saying? Anyways, I am rambling a lot. There's just so much to fit into one video. It's a very complex field. But either way, make sure that they generally have a safe ratio. If they're like, oh, well, we're understaffed and we usually have 1 to 25, get out. Get out right now. Make sure you ask what your generalized job responsibilities are. Facilities can be so different, especially between home health, long-term care, assisted living. Hospitals, your responsibilities are going to be so different. Generally, when you get your nursing assistant's license, you have a specific type of facility that you're allowed to work in. For example, I am registered as a long-term care nursing assistant, meaning my schooling was primarily done about elderly individuals in a long-term care setting, but up on the Certified Nursing Assistant Board of Oklahoma, it would specifically show LTC, long-term care certified. So make sure you find out what your job responsibilities are. I've worked in a normal skilled nursing facility, long-term care facility, where we do restorative. We have a hall of people that are hoping to go home. You know, they'll be here for a couple of months, but they're going to get their strength up and go back home. And then we have the rest of our halls are people that live there long-term. There's some memory care individuals, there's full dependent individuals that need lifts, like horror lifts and stuff like that. I've also worked at a facility that was specifically long-term care individuals, especially those with PEG tubes and on ventilators, or feeding tubes in general, but all of them had PEG tubes. They didn't have NGs, as they had the ventilator, which pretty sure those two would not work together. Just know what your job responsibilities are and what you're willing to do, what kind of facility you want to work in. You can get certified as a pediatric CNA. You can work in a hospital or as a clinic with children. That is a thing. Restorative CNA, the RNA that I was talking about. You can work in a hospital. You can work in home health. There is so many options. So many options. If you are doing your schooling through a facility, check your contract, like I mentioned earlier, and know what kind of pay and hours you want going into the job. Holidays, because oftentimes you will be working national holidays. Unfortunately, this is not the place that you get those off. You know what I'm saying? It's not like the residents just stop existing on Memorial Day. So you will be working the 4th of July, Christmas. Oftentimes you will get bonuses for those kinds of holidays, but you might have to give them up. They're often blackout days where you can't call out unless you've scheduled it off 5 months in advance. So good luck with that if you're somebody that goes home for Christmas. When it comes to hours, it's really common for a lot of places to do 3 12-hour shifts. That's how it was at the ventilator facility that I worked at. At my current facility, they offer 16s. You can work 2 16s with Baylor pay, meaning you work 36 hours, but they pay you for 40. They also offer 5 days, 8-hour shifts. I do kind of a weird schedule just so that I can get my 40 hours in, because I went down to part-time and now I'm back up at full-time, but we're significantly more staffed than we were before. So I just kind of had to have a weird schedule so that I could fit my 40 hours in. I work 3 8-hour days and 1 16-hour day. So just know what you're willing to work when you go into it, and 2 16s sounds nice until you have 5 hours of sleep and a 16-hour day. So keep that in mind. That being said, what does a day in my life look like at a skilled nursing facility? I clock in at 11 p.m. and I get my report / compliance, whatever you want to call it. My facility calls it compliance because it's not as detailed as a nurse's report's going to be. I mean, we don't go over all the health conditions and everything, just everything that's necessary to take care of the resident, what you need to know. Is this new person that's been transferred over here a 1-person assist, a 2-person assist? Are they incontinent? Can they eat and drink themselves? That sort of thing. Generally, after that, I'll make sure I'm stocked on everything. Do I have enough urinals to change the urinals out? Do I have ice because we pass ice? Do I have enough linen and briefs to change everybody all night? Because I do work at a large facility, it kind of varies hall to hall. For example, if I'm on one hall, generally I'll start my first round at 11 to 11:30. so that I'm kind of an hour earlier, because some halls have a lot of people to get up in the morning, and if I start my last round at 6 o'clock, I'll be there till 8 o'clock, to be honest with you, because there's 4 to 6 people to get up on certain halls. So I'll do my rounds at 11, 1, 3, and 5, and then if I have time, check everybody at 7 before I leave. If not, I'll let the next shift know, hey, I did my last round at 5. You might want to check everybody real soon. Generally though, if I'm on a hall with not a lot of get-ups, I will start my first round at 12 a.m. and I will turn everybody onto their left side. Now, some facilities have specific turning schedules, some don't, but you want to remember that generally, if a person is paralyzed, if they have very low mobility, if there's somebody that has to use a wheelchair or help getting up in the morning, you know, they don't have a lot of things that they can do themselves, you're gonna have to turn them every 2 hours. So I do my first round, I check everybody. Those that I know have accidents or are incontinent, I will change them or check them, see if they need to be changed at this time, and I will turn those that need it onto their left side. At 1 a.m., oftentimes I'll be starting to run out of laundry. So generally at 1 a.m. I'll go to laundry. We don't have a laundry aide at night, so we'll have to bring our dirty laundry down there, wash it, dry it, fold it ourselves, restock, start to wash any, for lack of better words, I'm going to say utensils, you know, the bedpans, the kidney dishes, the MSS basins, the urinals, anything like that. I'm going to soak those and then turn the heater. At least in my facility, we have like a very hopper room with a sink in it that's very massive, and you fill it up with hot water and a bunch of very strong sanitizer, and then we have a heater that gets very hot to sanitize everything. So I wash all that. I kind of go around, make sure everything's clean. If somebody's out at the hospital, you know, make their beds, clean rooms, take trash out of rooms, things like that. At 2 a.m., I do my second round. I try to turn people onto their right. So, you know, you want to go left, right, back, or whichever way. It could be right, left, back, left, back, right. It doesn't matter. Either way, I turn people onto their right. I do my round. At 3 a.m., I'm going to be passing ice. I'm going to be filling up everybody's water, giving them ice. Generally passing ice and or water to everybody. My video stopped. I was recording for way too long, so this is probably gonna suck to edit. So anyways, I'm gonna pass ice, do my kind of generalized tasks, everything that I've mentioned before, laundry, cleaning, yada yada. At 4 a.m. I'm gonna do a round, turn everyone onto their back. At 5 a.m., at least on the hall that I've been on for the last 2 weeks, everybody is pushing their call lights, can I have coffee? So I go make sure that there's coffee, bring some coffee up, get everyone their coffee, kind of got to learn what everyone likes. Start my get-ups if I have any get-ups, getting people up, especially when they're incontinent, and use a Hoyer lift or a sit-to-stand. It can take a particularly long amount of time, especially because for safety reasons you should always have at least 2 people for any kind of mechanical lift, and then if anybody is a 2-person assist, you'll need 2 people for that as well. So it can take a lot longer, so I start my get-ups, honestly, depending on what hall, 4:30 to 5. Yeah. I start my charting around this time because it can take, again, it really depends on the day and where I am that day, but whether I have more residents or not, it can take a long time to get through the charting. Every place does charting differently. In my facility overnight, we chart how people turn. Can they turn themselves? What's their general mobility that night? And if they've had bowel movements, and if they've avoided at all, which is urinating. So I'll start my charting. I generally won't put bowel movements in until 6:30, 7 o'clock, because people get real poopy at the 6 o'clock round, I've noticed. They'll hold it all night. You know, I'll do my general tasks again. 6 o'clock, I do my last round, turn people onto their left, clean everything up, make sure everything's restocked for the next shift, make sure there's linens if possible, make sure there's clean utensils. I can't really think of the best word for those things that I'm looking for, but again, I'm talking about the urinals, the bedpans, everything like that. Finish my get-ups, clean, restock everything. After my last round, I'll then take the trash out so there's not dirty briefs sitting in the hopper room all day, stinking up the place. You might have noticed that I don't clean the wheelchairs at night. This is actually something in our facility that the maintenance crew does so that they can inspect the wheelchairs when they clean them so that they can make sure that everything's working right. So that's why I did not include this. But I know oftentimes that is the job of overnight shift because the residents will be out of their wheelchairs more at night and you'll have that little bit of extra time to go around and get everything done. From 6 to 7, I'll finish up charting and then finish anything I might not have been able to do and give my report / compliance to the oncoming shift. They get there at 7. In between all of this, you know, I'm answering call lights, helping people to the bathroom when they need it. Some people don't follow the every 2-hour schedule, you know. Some people need it every 45 minutes, some people need it every 3 hours. So those that can tell me or verbalize that they need to use the bathroom, I'll help them when they need it specifically, which is why things can get really busy, even at night. People need their call lights, they want to turn, they need to be changed, they need to go to the bathroom, they'd like something to drink, they need medicine. All those type of things are just some of the reasons that people will turn their call lights on. And especially since I work in a facility that deals with memory care residents, people can get very agitated at night. To be quite honest, I sometimes work day shift and am very surprised of how lucid some of the residents are because I'm used to dealing with them at night. Sundowners is very real, and sometimes I just don't see the full spectrum of their personality, so it can be a little bit difficult to deal with those residents overnight. Overall, I'd say that it is a very difficult job physically and emotionally, but it is very, very rewarding. It is something that kind of gives me a purpose in my life, and I like taking care of people, and there's nothing that brightens my day more than the residents smiling at me, saying thank you, and just being happy that somebody is there for them. A large amount of my job is taking care of the physical aspect of these residents, but occasionally when I have time doing something nice like making a card for them. There was one point that a resident made a card for somebody on his birthday and wheeling her down there to give him that card, and she was giggling and so happy. I mean, that's what the job is for, even though sometimes the residents be kicking and punching and biting and screaming. You know, at the end of it, sometimes they'll cuss you out when you're changing them, and sometimes they'll say, I'm sorry, I'm so mean, thank you, it's uncomfortable for them, you know. Being in a nursing home is not a very comfortable scenario. I mean, think if you had to let go of everything you know in your life because you've lost your mobility or you became disabled for some reason. It's not easy, especially when you have some sort of dementia, Alzheimer's, any kind of memory care issue. It's very scary. You don't know the people around you. You can't remember where you are. Of course you're going to be combative. It's frightening. And one thing that I've actually learned is very common with dementia residents is physical resistance, and it's involuntary. For example, if you're trying to undress somebody for any reason, they're ready to go to bed or shower or need to be changed because they've soiled themselves, and they'll grab on really tight. It is an involuntary action. Same thing if you're trying to sit somebody up that has mobility issues and they're pulling against you. That's involuntary. They're not doing it on purpose. Most of the time, they're not doing things to make you mad. But when they are, again, it's because they're frustrated. This place is their whole life now. You know, they can't go outside when they want to. They can't do things when they want to. They can't eat when they want to. You know, you have to have a lot of empathy. You have to have a strong stomach or develop a strong stomach, because you're going to be dealing with feces, urine, sputum, vomit, wounds especially. Yeah. And you have to like what you're doing. It can be a hard job, but it's rewarding. And I really hope that you choose to become a PCA, a personal care assistant, direct care aide, a nursing assistant, whatever it is that you want to do, go for it, to be honest. Just do it. And if you don't end up liking it, finish out your time that you need to be there respectfully. Be responsible, do your job, take care of the people you're there to take care of, and then move on. Anyways, I hope you enjoyed this video. Maybe I'll make one talking more about being a PCA or working at an assisted living facility as a direct care aide in the future. But this video is probably already like 2 hours long, so I'm not gonna include that in this video. But thank you for watching. I hope you enjoyed, and have a good night, because it is 10 p.m. and I am, like I said, a night shift aide, so I'm just getting my day started. But I will see you later.